عليكم السلام ورحمة الله.
الله يحييك دكتور عبدالإله، والله يحيي الجميع معنا في اليوم العالمي لسلامة المرضى، وشكرا لوجودك معنا دكتور.
حياكم الله. أنا ما أعرف شايفيني ولا أنا ما شايف نفسي، فبتأكد إنه
شايفينك، واضحة صوتك وصورتك واضحة. أنا أحب أحيي فيك دكتور عبدالإله وأشكرك لقبولك الدعوة ووجودك معنا في هذا اليوم المهم، يوم العالمي لسلامة المرضى، بقيادتك وبإلهامك وبحماسك من بداية إنشاء مركز سلامة المرضى لخدمة هذا التوجه. وكذلك يعني أحب أشكر الجميع لتواجدهم معنا لإنجاح هذه المنصة حقت المحاضرات الإلكترونية. كذلك يعني دكتور عبدالله، يعني العمل الرهيب الجبار اللي قام به مركز سلامة المرضى لإطلاق برنامج صوتك يوم العالمي لسلامة المرضى، يعني زادنا حماس وشغف وخلنا الرؤية تتبلور وتكون واضحة أمام عيوننا. سلامة المرضى في بلدنا حتكون مبادرة رائدة يتعلم منها الدول الأخرى بإذن الله تعالى. إطلاق صوتك اليوم في اليوم العالمي لسلامة المرضى، أنا أشجع الجميع، جميع المنشآت الصحية، وحنبدأ بإذن الله تعالى معك ومع فريق مركز سلامة المرضى في وزارة الصحة إنه نستفيد من هذا البرنامج وننشر ثقافة سلامة المرضى والمعرفة والتوعية لتحسين الممارسات اللي تساهم في تحسين ثقافة سلامة المرضى. كلنا نحلم كنا في المنشآت الصحية على تحسين ثقافة سلامة المرضى والممارسات، واليوم الحلم أصبح حقيقة يا دكتور عبدالله. نشكرك جدا ونشكر فريق العمل من مركز سلامة المرضى، وهذه شراكة من مركز سلامة المرضى مع جميع القطاعات الصحية، احنا سعيدين جدا فيها، ونكمل بإذن الله تعالى هذه المسيرة مع بعض. بشكرك جدا مرة أخرى، وأحيي جميع الحضور معنا في الويبينار اليوم. نكون معاك إن شاء الله مستمعين ونتعلم من التجربة، وبإذن الله تعالى يكون لنا مستقبل جهود ويد بيد مع جميع القطاعات مع جميع الممارسين تجاه هذا الهدف السامي لخدمة بلدنا وخدمة هدف سلامة المرضى. يعطيك ألف عافية، وحترك لك المايك مع الزملاء الحضور. شكرا جزيلا دكتور عبدالله.
العفو، شكرا استاذ عبد العزيز على your leadership ودعمك، ويعني انت عضو مجلس اداره في المركز، فانت يعني احد رواد سلامه المرضى واحد رواد القطاع الصحي في المملكه. السلام عليكم ورحمه الله جميعا. يعني اليوم يوم مميز، كون هذا أول يوم يحتفل فيه العالم بسلامة المرضى كمبادرة هذه أطلقت اسمها اليوم العالمي لسلامة المرضى. كل دول العالم نتوقع اليوم على جميع القارات راح يكون فيها أنشطة ومبادرات لتحسين سلامة المرضى. أنا أتمنى بداية إنه على حسب عدد المسجلين في الويبينار هذا اليوم يمكن وصلني إلى قريب 1000. تخيلوا لو إحنا كل شخص سمع الويبينار اليوم وبعض الأفكار اللي أديرت فيه والأهداف اللي قاعدين نشتغل عليها، وصل هذه الفكرة ل10 أشخاص فقط، وبعدين كل شخص وصلت له الفكرة والأهداف والاهتمام وأهمية سلامة المرضى، لو لم يصل له أي شيء إلا أنه موضوع سلامة المرضى هذا هو اللي يتمحور عليه كل عملنا في القطاع الصحي، هذا في حد ذاته خير كبير. فتخيل اليوم إذا في 1000 شخص يستمع الآن للويبينار هذا، وكل واحد من اللي استمعوا وصل انه ترى سلامة المرضى مهمة ل10 اشخاص، لكن وصلها برسالة كمان انه لو سمحت وصل انت المعلومة ايضا ل10 اشخاص، كل واحد يسمع المعلومة انه والله الموضوع هذا مهم يوصل الى 10 اشخاص. انا ماني خبير رياضيات، لكن العدد راح يصل الى الملايين بالطريقة هذه، انه اذا 1000 شخص كل شخص وصل ل10 اشخاص وفي نفس الوقت طلب من كل شخص يصل له المعلومه انه يوصلها ل 10 اشخاص، هذه راح تكون زي السنوبول افكت. انا يعني شخصيا كجراح ممارس في القطاع الصحي، اشتغلت في كندا، في امريكا، وعندي زملاء كثير في يوروب. مؤمن يعني كامل الايمان انه قطاعنا الصحي في المملكه بالكفاءات اللي موجوده، وكثير منها اليوم قاعدين يسمعوا لنا وهم متميزين في جهات مختلفه، بالدعم اللي هو موجود من القيادات في القطاع الصحي، وبالدعم من حكومه المملكه في اصلا اهتمامها بهذا الموضوع، ويعني انشائها للمركز السعودي لسلامه المرضى كأحد مبادرات برنامج التحول الوطني 2020. وقبل هذا كله بالحماس اللي موجود لدى الناس، انه المفروض انه القطاع الصحي اليوم بكل المقومات هذه مؤمن كامل الايمان انه عنده الامكانيه انه يكون من افضل 10 قطاعات على مستوى العالم. وانا ما اقول الكلام هذا يعني من باب المبالغه، ولا اقول الكلام هذا من باب انه بس الحماس، اقوله من باب المعرفه بالامكانيات الكامنه داخل القطاع هذا. القطاع الصحي يعمل على خدمه المرضى وتقديم الرعايه لهم بتجربه ممتازه. لو استطعنا انه دائما كل يوم على مدار السنه انه نضع في انصب اعيننا انه سلامه المرضى والسلامه بشكل عام للممارس ايضا وهي الاولويه، راح ان شاء الله باذن الله نحدث نقله نوعيه في التجربه. اليوم في يعني من بدايه اليوم الى الان ما شاء الله انشطه على يعني جميع المناطق المملكه، من شمال لجنوب، من شرق الى غرب. كان في عندنا وفد من دوله الكويت، هم بعد مشاركتهم في القمه الوزاريه الرابعه لسلامه المرضى انشأوا اداره لسلامه المرضى، وكانوا مهتمين انه يزوروا المملكه في اليوم العالمي لسلامه المرضى عشان ينظروا للتجربه اللي على اساسها كان انشاء المركز، وينظروا لتجربه تحسين سلامه المرضى. وهذا اللي احنا عملناه. تحسين سلامه المرضى هي ليست فقط مسؤوليه المركز. المركز هو عباره عن افضل وصف ممكن الواحد يوصفه انه منسق للجهود هذه، لكن الجهود هذه موجوده في جميع مكونات القطاع الصحي. فاليوم كنا في زياره للهيئه السعوديه للتخصصات الصحيه، وعرضنا تجربه الهيئه والتعاون معهم في تحسين سلامه المرضى، وكيف انه الهيئه واضعه نصب اعينها انه تحسين سلامه المرضى بيكون من ضمن وجود qualified healthcare professionals. وبعدها كمان زرنا المستشفى الملك فيصل التخصصي، وعندهم يعني تجربه رائده، والليدرشيب في كينج فيصل سبيشالست هوسبيتال is aiming to reach zero harm. يعني بقياده الدكتور ماجد الفياض والليدرشيب في التخصصي سمعنا الى تجارب جميله رائده. والتخصصي كمثال، المتاكد كل واحد فيكم في منشاتكم في كثير من القصص الرائعه اللي احنا ممكن نستفيد منها. وجدا انا مهتم اليوم انه نقدر نطلع بمبادره انه كيف احنا نتعلم من بعض. اليوم هو زي ما ذكر الأستاذ عبد العزيز إطلاق صوتك، ورسميا أطلقوا معالي الوزير بالأمس، لكن نبغى نشوف كيف نقدر إحنا حتى من طريق صوتك وغير طريق صوتك، إذا في أي تجربة رائدة موجودة في أي مكان في القطاع الصحي إنه يتم نشرها والاستفادة منها في جميع مكونات القطاع. I'm going to speak in English just to in case that we have audience with us that do not understand Arabic. So basically, I'm not going to go into every point of the slide, and I want you to think about why do we think, you know, there are three questions that I hope I would be able to answer through my presentation, and then I'm going to end with the way forward. I'm going to end with how can we have a bold vision of trying to reach zero harm in the kingdom. It's always, you know, leadership is not about having the answers. It's about making sure that we ask the right questions. I think only when we ask the right questions and the enabling questions, the empowering questions, that we could come up with different ways to solve them. For the longest time, people used to think that zero harm is just impossible. We're just imagining, we're not realistic. And people now move towards actually saying that zero harm is something that is a necessity, and it's something that we need to aim for. So the more ambitious and empowering the questions we ask, the better the likelihood of trying to transform safety. So this was a clip that we showed in the Global Ministerial Summit, and it's not going to play. The whole idea was simple in this clip, that in other industries, if we go back 50, 60, 70 years, we looked at three main industries: aviation, oil and gas, and nuclear industry. And the question was the level of safety in those industries 60, 70 years ago the same as it is today? And the answer is simply no. But with number of accidents and major incidents that took place, those industries realized that a tipping point was reached and something different needed to happen. And that resulted in transforming safety in those industries. So we put that question forward in 2019. 2019 marks the 20th anniversary of the Air is Human, which is one of the most important papers that started patient safety movement, not just within the United States, but globally. So 20 years from that very important report, where are we? What was done? And are we better off in improving safety? And I think a lot of countries and a lot of healthcare systems realize that we learned a lot in the science of patient safety. I think there is a feeling that we need to work on implementation science initiatives. So we know that healthcare-associated infections are caused by many factors, but the most important factor is lack of hand hygiene compliance. Why is it still that the hand hygiene compliance rates across the planet is between 40 and 50%? And you can go through different aspects that we know the science and the causes behind different things. The thing is, why is it that we're not transforming safety? And again, this goes back to trying to think differently about implementation. So we know we have enough information about these different causes. We need to start having innovative solutions to try to transform safety. And I argue that one of the innovative solutions that we could come up with and we could start doing from today is to start having a platform to share the learnings with other healthcare facilities. Just for those of you who do not know the date that the center was established, the center was established on the 19th of March 2017. And over the past 2 years, as I mentioned, this was an initiative of the NTP 2020, and the goal of establishing the center is to try to have an entity that could coordinate all the patient safety improvement efforts that are present in the healthcare sector. So the center is engaging regulators, it's engaging providers, and it's also trying to work on empowering patients and their families, because the more empowered the patients and families are, the less likelihood that they would be harmed, and the more likelihood that they would become an active participant in their care to push and advocate for their own safety. Again, this is where as I mentioned, this kind of just repeats the fact that the Patient Safety Center is engaging all the regulators. It's also trying to work with the providers. And thank you so much. Many of you today are having events to celebrate patient safety improvement, to reward those people that have actually done some good improvement projects. And also, there's a lot of focus on empowering patients, on improving their experience, which in a way, we view that patient experience and patient safety are two sides of the same coin. So bad experience could either result in an incident in itself, or could be a risk factor for leading to harm. So bad experience could either be a harm or something that leads to harm. So think about the efforts that the Saudi Patient Safety Center is doing in terms of three types of stakeholders: engaging the regulators, engaging the providers, and engaging patients and families. So to try to empower the patients and the community. That's the vision statement, and it's safer healthcare for all. And as you can see, all here is a capital letters, just to show that it's not just patient safety, but it's also the workforce safety. So we don't think of patient safety and workforce safety as either or. These are complementary to each other. So you cannot have patient safety without staff safety, and vice versa. So the mission statement is a mouthful. It talks about to eliminate preventable harm in our healthcare system by empowering patients and supporting healthcare professionals through building capacity, partnering with stakeholders in developing national policies, creating evidence-based guidelines, and executing programs. So in other words, the mission statement is about zero harm. Think about your own facility, about your own clinical unit. How can you have zero harm in your own facility? I just came from King Faisal Specialist Hospital, and they have celebrated 10 today with their CEO, and they celebrated some of their units that went 180 days without harm. So they had units that celebrated going 180 days without harm. I'm very interested to hear from you as well if you have any of your units that went whatever amount of time, even a month without harm. I think is a good basically a first step. You know, رحلة الألف خطوة تبدأ ولا رحلة الألف ميل تبدأ بخطوة. So if any of you have are working in units that went 1 month without harm, please share that story with us, and we need to make that available to the rest of the healthcare system, because one thing that we can do better today is we could start learning from each other. Let's not keep the learning and the benefits that come out just stuck to our own hospitals or our own units. Let's start thinking about how can we develop those sharing networks. Let's use the center as a platform where you guys could share with us your improvement stories, and we could make those available so we could actually make sure that the rest of the healthcare system benefits. This is just to give you an idea about the strategy map, but before that, you know, the center was established as one of the National Transformation Program initiatives. So whatever we do in the healthcare system, we need to make sure that we're also contributing to the goals of the Vision 2030. One of the goals of the Vision 2030 is to increase average life expectancy from 74 to 80. So basically, if we minimize preventable death, so unexpected death, whether in maternal mortality or in infant mortality, or in, you know, young people dying from preventable harm, this could really boost the goal of the Vision 2030. And, you know, this is just one example of how to align with the Vision 2030. Just briefly about the strategy map of the center. So we've got this balanced scorecard format, and the foundation of that is the learning and development. And then we've got the internal processes, the customers, the outcomes, and the vision. So the foundation is building the capacity, so having qualified, competent employees. And the same, you could think about that within your own organization of how to have the good foundation, the competent, qualified, and empowered employees that could speak up if there are any potential safety challenges, and you know, they could speak up on behalf of their patients. And just as a reminder that speak up is actually the slogan of the patient safety, the World Patient Safety Day this day. So, you know, we're saying speak up for patient safety in English. We're saying صوتك مسموع بالعربي. So, and I think this applies to both, whether patients or and families or healthcare professionals. So I think if we try to really boost this practice of creating safe environments for people to speak up, and at the same time trying to make sure that we're proactive and we take initiative to speak up whenever we think that there is a potential safety hazards. I think this is this would really boost patient improvement practices within organizations and throughout the healthcare system. So the internal processes, we're talking about monitoring here, and I'm going to spend some time talking about SOTAC project in some details. Innovation. We need to think of innovative ways to improve safety. And we're talking about around 10% of adverse events in advanced healthcare systems. In low and middle income countries, that could reach up to 30%. So, as Einstein says, we can't solve the problems by the same level of thinking that created them. So how can we think of innovative ways to solve, the safety problems? How can we think of innovative ways and use human factors engineering to avoid even getting into risky situations? As I mentioned, the customers are patients and families, healthcare providers, and regulators. The outcomes of patient safety. So now, if you think about how to reach safer healthcare for all, I want you to think about three foundational activities that we need to have in the healthcare system to be able to move from point A to point B. So one foundational work is to have a reporting system for adverse events. This is, inshallah, will be delivered by having SOTAC. So SOTAC is an adverse events reporting system that, it's our national reporting and learning system. It would help at the level of the facility because you will have a way to understand the different levels of adverse events and harm at your own hospitals and try to think about root cause analysis and corrective action plans. But at a national level, this would help give us an idea about what levels of harm are there in the system. At any given point, we could say that these are the top 5 or the top 10 adverse events in the healthcare system. And with time, over the next 3 years, we hope that the majority of hospitals within the kingdom will be part of SOTAC, and the learning will be multiplied. So not only that hospitals will have means to learn within their own facilities, but also at the national level, we would be able to have understanding of some common themes and some trends in safety, challenges that we could improve. So the one foundation is having a reporting, having an effective reporting system that would give us an idea about the harm. Another foundational aspect of patient safety is the hospital patient safety culture survey. We also established an electronic platform, and thank you very much for most of you who are contributing to this. It's always said, culture is local, so when you're actually using the platform to do the patient safety culture survey, hopefully you will understand your patient safety culture challenges within your own facility and even within departments. But this will give us a platform to benchmark where we are when it comes to the patient safety culture situation. There was a phase 1 exercise that we've done around patient safety culture survey. So there was a major work within the Ministry of Health hospitals, but we also had contribution from other sectors, and they shared with us the results of their patient safety culture survey. And we found that there were 3 out of 12 domains that every sector within the kingdom have basically similar performance at. It's actually even I had discussion with colleagues from Singapore who say that they actually have the same kind of findings, that out of 12 domains that are there in patient safety culture survey, 3 areas had weaknesses. So I think many of you probably have kind of gone through this or thought about it. So one area of weakness is communication openness. And as you know, and then, the JCI talks about 70% of sentinel events are caused by, communication challenges. So this was reflected on the patient safety culture survey, that there is a challenge with communication openness. Another area of challenge that was present in all sectors was the non-punitive measures. So many of the people that have taken the survey are concerned that there is a problem with punitive measures, that we still need to do a lot of work to move away from shame and blame culture into just culture. So when we talk about just culture, it's not about basically having blame-free practices, but it's about making sure to make a clear distinction between a blame-worthy event. So if I'm on call and I do not show up for call and patients are harmed, if I'm being called to the unit and I don't show up and patients are harmed because I'm negligent, then this is a blame-worthy event. But if something happened to patients and patients are harmed because of something that is not intended, because of no negligence that is there, then this should not be treated as a blameworthy event. Again, the non-punitive measures was an area of weakness, and the third was staffing. So as we know that there is an association between the level of staffing and the safety. If you have a clinical unit where you have 1 nurse per 10 or 15 patients, the outcomes and the potential harm is going to be very much exaggerated and elevated compared to a clinical unit where you have 1 nurse per 4 or 5 patients. So the impact of staffing on patient safety is important. So again, these were 3 areas that we found that there were some weaknesses. We came up with recommendations, and we established a committee with representation from different sectors that helped us draft those recommendations, and hopefully we're going to share with you those recommendations in the next few days. So as I mentioned, if we're talking about 3 foundations of patient safety, one foundation was the reporting system. The second foundation is the patient safety culture survey. The third foundation is patient safety KPIs. So again, to be able to have a national benchmark where we could speak the same language, having a unified patient safety KPIs that every hospital and every sector is following and measuring is very important. The Saudi Health Council lately had a meeting where a set of KPIs around safety were approved, and hopefully an official report will come out of those. So you could think of basically the 3 examples that I mentioned as 3 foundations of patient safety that are going to be very exciting, because we could use those as national benchmarks, and we could say this is where we are as a country, without getting into any confidential information of any hospital. We're talking about nationally where we are, and then how could we put goals to move those safety KPIs, how could we put goals to improve the safety culture, and how could we put goals to reduce harm in an objective way. So one thing that we're also are trying to finalize is, now that we have the National Reporting and Learning System, is to do a nationwide study with Johns Hopkins to try to have a more objective assessment of the level of harm that we have in the Saudi healthcare system. So stay tuned for that study. Hopefully within the next few months, we're going to start rolling out such a study. So as I mentioned, the patient safety culture survey is something that is important. We did talk about. Today is September 17th. By December 7th, and we will have our second International Patient Safety Conference. So I remind you that our Patient Safety Conference has 4 components. It has the workshops, which will be on day 7. It has a public event called the Lسلامة, where it's patient safety event for the public. So it will be in Arabic language. We're going to engage different parts of the community, school students, university students, volunteers, and patient groups to talk about patient safety from their perspective. The third component is the conference. So this is the scientific 2-day conference where we have key lectures and different tracks. The fourth component is the National Patient Safety Award. These are the numbers from last year. We had more than 1,000 applicants, 1,095 to be precise, and we ended up having 8 winners. The winners were giving the award from His Excellency, the Minister of Health. Their projects were actually very unique projects, and we wish to see more applications and more innovative and unique projects this year through the National Patient Safety Award ceremony. I'm going to skip this for the sake of time, and just to highlight the patient safety KPIs. Hopefully, once the Saudi Health Council's official report comes out, we would make sure that we start advocating to have those patient safety KPIs assessed in the same way, because when it comes to KPIs, you want to make sure that we're having the same definitions. So these are important areas to keep in mind. And again, we view patient safety KPIs as one of the foundations to improve safety. And every one of you knows that you cannot improve what you cannot measure. So when we have an objective assessment direction. Again, maybe with medication safety, I'm just going to highlight PharmaSafe. So PharmaSafe is one of the initiatives that we thought would help with 2 aspects. It would help with medication safety in the community pharmacies, but it also would help with community empowerment. So think about this. Community pharmacies are almost 10,000 in number in the kingdom. Many of us go to community pharmacies for so many things. Imagine if those community pharmacies would improve their medication safety practices. Imagine if they could even become an advocate for patient safety within the community. I think the impact would be huge. So great potential to improve medication safety and overall patient safety. great potential for community empowerment through pushing pharma-safe. Infection and prevention and control is important. Hand hygiene is something that we really need to think of innovative ways to handle. This year, we have applied with an initiative from the Ministry of Telecommunications. It's called جسارة. جسارة هي مبادرة من وزير الاتصالات. It's about crowdsourcing ideas. So we put a question to the community. It is done in a very innovative way. So they have a virtual innovation platform. So this is a platform where entities, whether healthcare or others, put in certain questions, and then they send those questions to a sample representative of the public, and they crowdsource ideas. So we've applied to this initiative, and we basically put in a very bold outcome. We said the following: most healthcare-associated infections are caused by lack of hand hygiene compliance. Now, there are other factors, but the most important factor for healthcare-associated infections is lack of compliance with healthcare, with hand hygiene from healthcare professionals. We cited a study that was done by the Ministry of Health that talked about on an annual basis in the Ministry of Health, around 11,000 people die from healthcare-associated infections. We cited that 99,000 people in the US die from healthcare-associated infections. And we said, and the evidence is clear, the better the hand hygiene compliance rate goes, the less healthcare-associated infections. So think about it like an X. When the hand hygiene compliance goes up, the healthcare-associated infection rates goes down. So we put in this question: how can we have 100% hand hygiene compliance rate from healthcare professionals? How can you share with us any innovative ideas of making sure that hand hygiene compliance is 100%? So how can we use the patients? How can we use their families? How can we use, technology? How can we use whatever? So we're not giving them answers. We're basically saying that this should be 100%. And we're still waiting, to get back using this crowdsourcing technique. So we're very interested in having some innovative, answers and solutions from the patients, from the community. And hopefully we can share with you the results once those results become available. But if there's anything that we can do, the only thing that we can do, if there's nothing that we can do in infection prevention and control, is to advocate and push for 100% hand hygiene compliance. And I think an important enabler here is to empower patients and families to remind us, healthcare professionals, to wash our hands. So stay tuned for the results of such an important initiative that we've done, and we'll share with you hopefully some innovative solutions. And why not? Maybe we can come up with something that would make the hand hygiene compliance 100%. Communication is important. There's a lot that needs to happen in communication. If there's one thing that I would say is to improve communication, think about communication as both verbal and non-verbal. And there's a lot of non-verbal communication that we do, which is in the form of documentation. If one thing that we could work on as an improvement is to make sure that we have effective documentation. Now that we're embarking on the ICD-10 rollout within the kingdom, the ICD-10 codes documentation. So you want to make sure that to have the right coding, we need the documentation to be effective and legible. So if there's one thing that you would remember from what I said regarding the communication, I would say it is the documentation. I'm just looking at my watch because I want to move quickly to صوتك. So in the next 10 minutes, I want to talk about صوتك. One word, please. Whatever we could do to empower patients. I know that I talked about empowerment, but I want to repeat talking about empowering patients and engaging the public. So if you don't have a patient and family advisory councils, please think about starting patients and family advisory councils in your hospital. If you have a patient and family advisory councils, try to make sure that those are effective. Try to engage patients in whatever way and shape and form that they can. Patients are and their families are actually very helpful and they're able. We just need to make sure that we enable them. So patients are able, we need to enable them. One quick word about the patient safety caravan. So this is an initiative that we're spreading out through the kingdom, and we're using a lot of volunteers to try to empower patients. So a group of people that visit hospitals, made up of patient safety centers employees and a lot of the volunteers, and we engage with the patient experience departments, and we go and visit patients in the inpatient setting, in the outpatient setting, and talk to them about some basic patient safety and patient empowerment practices. How to improve medication safety through their understanding of their rights, medication reconciliation. We talk to them about the importance of hand hygiene and how they should always keep reminding us about hand hygiene and how they could be an added eye within the system to help us boost the efforts of improving hand hygiene. We talk to them about informed consent and the proper way to do informed consent, and so on and so forth. So please remember patient empowerment. Whatever you can do today to just empower patients, whatever you can do to kind of move the needle into the right direction here, I think is very well, it's a very good investment. المقولة دائما إنه خير قليل مستمر خير من كثير منقطع. So sometimes big initiatives that just start and do not continue, they may not be as good as small initiatives that are actually persistent and ongoing. So think about the one simple thing that could be sustainable that you could do to empower patients and families. I'm going to go to صوتك. So basically, again, this is the whole system. His Excellency, the Minister of Health, yesterday has officially launched صوتك. صوتك in a simple word is referring to healthcare professionals. So because healthcare professionals would have the capacity to report, and patients also. And patients could report in two ways. They could report in the feedback module, so they can give feedback about their experience, either positive or negative. But also the other practice that we want to introduce is to have patients report about adverse events. and not necessarily every adverse event. So we're thinking about maybe having patients report about deviation from proper informed consent practices, or deviation from hand hygiene before they were examined, or deviation from medication reconciliation when the medication was prescribed. So this is still from the patient's reporting for incidents, it's still kind of being finalized, but otherwise the system now is mature, and all what we need to do is we need to have hospitals join in subscribing to the system at a facility level. Having SOTAC will help you, as I mentioned from earlier. It would help with understanding the magnitude of harm within the facility. It would help standardize the way to do root cause analysis, and it would help also come up with corrective action plans, and it would involve the different leadership that are needed. There's a problem in the operating room, then while the workflow is going through the analysis and coming up with recommendations, the involved parties are kept notified, whether it's the person who reported, or whether the department head in the operating room, or whomever, someone from the leadership also that is involved. As I mentioned, to make it easier for people to report, there will be two ways to report: either reporting through the portal using a desktop, or reporting through an app. So the whole idea is the easier we can make it for people to report, the more likelihood that people will report. But people have to see the benefit. So if I report without having benefits and without having feedback about the lessons learned that came out of reporting, I could report once or twice, but after a while maybe I would skip reporting. But I also want you to think about the bigger benefit that we could get when we think about this at the national level. So yes, we have 475 hospitals in the kingdom. When you have reporting from all those hospitals, think about the learning that we could come up with. The system could even forecast problems, so it does not need to kind of wait until the problems happen in every hospital. So in other words, we are trying to move from being reactive into being proactive. One thing that I mentioned earlier, which I think would be beneficial, is to try to move from reactive to proactive. A very important outcome that would come out of of SOTAC is patient safety alerts. We could come up with patient safety alerts. We could come up with ranking and certain benchmarking of certain adverse events. And the system has artificial intelligence, so it would learn with time. And I think if we could coordinate with the Saudi Commission to make sure that there's an efficient way for those reports to reach, those safety alerts to reach the healthcare professionals, I think the learning would be better. So my message to you about SOTAC is try to talk to your leadership within the hospital about SOTAC. try to encourage people, the leadership to join in, try to encourage the healthcare professionals that reporting is not about, speaking bad about your colleagues. It's actually about trying to come up with ways of learning. So to make sure that we could avoid those potential problems within the facilities, but because this is a national program, so the learning at the national level would be even multiplied, and just to reassure everyone, whatever learning that we will have at the national level is not going to be saying hospital X or hospital Y is having these problems. We're going to have anonymized data. So we're going to have data that says, well, the #1 adverse events in the kingdom is X, medication errors, patient falls, and then that could be broken down into different regions. So maybe by different regions, we have different adverse events, and accordingly, we could engage with those regions and try to look for innovative ways to solve these problems. In the last, again, in the last couple of minutes, I really want us to think about how can we figure out an innovative way for the learning to happen throughout the system. So every one of you within your own practice, within your own individual practice, within your own units, within your own hospitals are learning different, you're facing certain challenges, and you have some good and innovative ways of dealing with them. And some of those ways actually have worked very well for you. My question to you is, think about how impactful this could be if those experiences were actually distributed to the remainder of the healthcare system. So if there's a way that we could have a platform, and we're happy within the Saudi Patient Safety Center to have that platform, to make it available for you to share those experiences of lessons learned. So these are positive stories, that while we have SOLTAC and while we have the reporting, some of these positive stories may or may not be something that happened through your reporting system. It could be, some of the improvement projects that you worked on. Anything that you think that have worked and has the potential to be beneficial at a national level, please share with us. We will give the full credit to your idea, so it will be your hospital, your clinical unit, your facility, and it is something positive that many people will learn from. Again, at the end of the day, I'm very optimistic about the patient safety improvement projects within the kingdom. One thing that we're trying to do to make sure that the momentum for improving safety is there is we're trying to put patient safety on the agenda of the G20. As you know, that the kingdom will host the next year's 2020 G20, and we want to put patient safety on the G20 to say that it's not just about the importance and the business case for patient safety. It's not just about medical aspects, but also there's an economic case to be made that anyone who's harmed is lost by the country, so as a source for revenue generation, but at the same time, they will become a burden in the healthcare system. So in other words, and not only that people that are harmed are going not to be contributing to the economy of the country, they will also become a burden on the system. So hopefully we'll be successful in putting patient safety on the G20 agenda, and that would, if it happened, is another great opportunity to keep the momentum going and show the country's leadership in patient safety. So with that, I would really would like to thank you very much for listening. I hope that I managed to share with you some of the of the important projects. I think the most important project on the safety agenda today in the kingdom is SALTC. So please try to advocate for SALTC, and I remind you to whatever you think that you heard that you think is useful, share with other 10 people and ask them to share with other 10 people as well. So الله يعطيكم العافية. إن شاء الله كنت ضيف خفيف عليكم and يعني we're very optimistic that tomorrow will be better than today.
شكرا دكتور عبد الإله، والشكر للجميع، وإن شاء الله تعالى كل سنة يعني نحتفي بازدهار وتطور وسلامة المرضى في مملكتنا الحبيبة. أشكرك جدا دكتور عبد الإله وفريق العمل معك في مركز سلامة المرضى، وأشكر جميع الحضور اللي معانا اللي بدونهم وحضورهم وتفاعلهم ما حتنجح هذه المحاضرات في الويبينارز. كان في بعض الأسئلة في محطوطة في الشاتنج بوكس، بإذن الله تعالى حيجاوب عليها الزملاء جودة بإذن الله الجودة، وحيتواصلوا معاكم عليها في المستقبل بإذن الله. تابعوا حساب ويبينارز، زادت الكاباسيتي كانت 1000 والآن صارت 3000، هذا بفضل تفاعلكم ودعمكم.
ما شاء الله.
شكرا جزيلا للجميع. شكرا
جزيلا.
ألف سلامة إن شاء الله. شكرا.